Hi, my name is Meghan Bright. I'm a physical therapist here at Knob Noster Physical Therapy, and today we're going to go over some interventions and treatments for carpal tunnel syndrome. So I mentioned this in a previous video, but just to review what that is, it's basically underneath our flexor retinaculum here. We have our median nerve with some of the tendons that flex our wrist. And when that gets irritated, it can result in numbness, tingling in our first three and then half of that fourth digit there. So one of the common complaints with this is symptoms at night. So one of the first treatments that we recommend for patients is going to be, especially if you're experiencing symptoms at night, getting a wrist orthosis. So you can get wrist brace there that's going to keep your wrist in that neutral position, because oftentimes we end up going into a bent position here or a bent backwards position here, which can cause some irritation to the nerve. So those wrist brace are just going to allow us to stay in a neutral position and take away some of the stress on the nerve there overnight. The second thing we recommend is activity modification. So if you're in an occupation where you're using a vibratory tool, we're going to recommend taking a break from that. Or if you're at a desk and you've had issues with the positioning of your wrist, we recommend someone coming in, or we personally can go through with you some ergonomic changes to make to where your wrist is in a more neutral position for those activities. And then the best evidence for exercise, there's two exercises, a tendon glide and then a median nerve. These are the two exercises we typically start people off with who are dealing with this condition. So our tendon glide is basically just an exercise that is going to allow those flexor tendons to go through their full range of motion and decrease, get some blood flow and decrease some of the inflammation underneath that flexor retinaculum there. So when you're setting this up, you just want to make sure that your wrist is in a neutral position. It's going to be counterproductive if you're doing it with that wrist bent forward or backwards. So find that neutral position, and then you're going to come down here, and then you go straight down to the base of the hand, and then a full fist, and then you'll come back to neutral. So I'll show you guys that one more time. Here, here, and full fist, and then back to neutral. I'll usually recommend starting with like 5 to 10 repetitions and then doing it 2 to 3 times throughout the day. So we think about like our joints or a muscle, it's important for them to go through their full range of motion, and the same goes for nerves. So this next one we'll go through is just a nerve glide. There is a lot of variations that you can do of a nerve glide depending on your irritability or severity of symptoms. So if this one does worsen your symptoms afterwards, I recommend stopping it and trying to like come into therapy to get it looked at a little bit further. But an easy one you can trial if you're having these symptoms, I'm going to stand up to show you guys this, is you'll start with your arms in front of you. You're just going to come forward, bring the wrist back towards the side, and then come back down. It just looks like here, here, out, and then down by the side. Also recommend 5 to 10 of these, and to do these 2 to 3 times a day. So hopefully you found these tips and tricks for carpal tunnel syndrome helpful. If you're dealing with any of these issues, feel free to reach out to us at knobpt.com or give us a call. Thanks.